Can you identify cause of death just by looking at postmortem signs? In NEET PG Forensic, pattern recognition of asphyxial signs can be decisive. Today we decode the core types: hanging, strangulation, and drowning. Asphyxia refers to a condition where there is lack of oxygen in the body, leading to unconsciousness and death. Mechanisms include impaired oxygen entry, transport, or utilization. Key organs affected first: brain and myocardium. Hanging is a form of asphyxia caused by suspension of the body with a ligature around the neck. Typical mechanism: venous congestion, airway compromise, and vagal reflexes. Can be complete or partial, depending on full body suspension. The ligature mark in hanging is typically oblique, running upward towards the point of suspension. It is classically discontinuous at the back of the neck. The knot is usually present on one side, and the mark is not continuous. Postmortem findings include a pale ligature mark, dribbling of saliva, congestion of face, and cyanosis. Dribbling of saliva from the angle of mouth is a classical sign in antemortem hanging. Petechiae may be fewer than in strangulation, depending on circumstances. Remember, oblique, upward, non-circumferential, often with a lateral knot. Antemortem signs: vital reaction at the mark, dribbling, and internal hemorrhages. Postmortem suspension lacks vital reactions and typical saliva drip. Now contrast this with strangulation. Keep the ligature mark orientation foremost in your mind. Any interruption of oxygen pathway, entry, exchange, or circulation can result in asphyxia. Irreversible neuronal damage can begin within minutes. On to strangulation specifics. Section 2. Strangulation Essentials. Focus on mark orientation and associated injuries. Let us proceed. Ready. Begin strangulation. Strangulation is caused by compression of the neck without suspension of the body. It may be manual, ligature, or forearm-based constriction. Rapid venous congestion and airway compromise produce petechiae. The ligature mark in strangulation is horizontal and completely encircles the neck. Unlike hanging, it is circumferential without an upward obliquity. Material imprints may be present, with deeper abrasions. Bruises, nail marks, and abrasions are commonly seen. Postmortem findings include congestion, petechial hemorrhages, and sometimes fracture of hyoid bone. Hyoid fractures are more likely with manual strangulation and increased age. Drowning occurs due to inhalation of water into the lungs. Aspiration leads to impaired gas exchange and hypoxemia. Surfactant washout can cause alveolar collapse. A classical feature is fine white froth coming out of the mouth and nostrils. The lungs become heavy and waterlogged. Washerwoman changes of skin, froth, and water in lungs are key postmortem findings. Here are classic washerwoman changes due to prolonged immersion. Other types include suffocation, smothering, and choking. Smothering blocks external airways. Choking obstructs internal airway. Suffocation lowers ambient oxygen. Differentiate from chemical asphyxiants like CO, which produce cherry red lividity. In summary, hanging shows oblique ligature marks, strangulation shows horizontal marks, and drowning shows froth and water in lungs. Think orientation, continuity, associated injuries, and fluids. Mark orientation is the fastest differentiator in exams. Understanding these features is essential for forensic diagnosis. Subscribe to PJ60 for more NEET PG concepts. Study smart, practice questions, review key signs. All the best for NEET PG. Thank you for watching. Goodbye. Continue your learning with the next module.